Oh, wow. It sure is a beautiful day to be running, huh?
Yeah, it is. Oh no,
What's wrong? What's happening?
I'm having a bit of a hard time breathing right now.
Oh, no.
A hard time breathing? Samantha, it sounds like you're having an asthma attack. Symptoms include shortness of breath, wheezing when exhaling, chest tightness, and coughing. Asthma is characterized by narrowing and swelling of the airway, which in some cases can lead to the production of extra mucus. These factors make it difficult to inhale and exhale. To reverse these effects, patients should use albuterol. Here, Samantha, here's some albuterol.
Oh, thank you. I feel a lot better now. Thanks so much.
Albuterol, commonly available as a racemic mixture of both enantiomers, it is a drug that is used to treat constriction of the lungs. Biologically active R-albuterol, also known as salbutamol, has the following structure. It belongs to the family of substitutive phenethylamines, and it is structurally and functionally similar to norepinephrine in biochemistry.
In the 1960s, there was a Scottish chemist named David Jack at the Allen and Hansberry lab, which was part of a larger pharmaceutical company called GlaxoSmithKline. At the time, there was a drug called isoprenaline, which was used as a bronchodilator, but it was very non-selective and led to many side effects in the heart. So he set out to find a more selective drug with fewer side effects. In 1966, he discovered salbutamol, which was a beta-2 adrenoreceptor agonist that was more selective and could be used as a bronchodilator. Shortly after, in 1969, it was launched under a drug name called Ventolin and sold in the UK to treat asthma. In 1982, it was approved for medical use in the United States. In 2020, the first generic drug for salbutamol was approved by the FDA. Albuterol is most commonly used to treat bronchospasm, which is the construction of muscle walls in our airways called bronchioles. Bronchospasm can cause wheezing and make it difficult for people to breathe. This is what happens during asthma, and so albuterol rescue inhalers are often used to treat asthma attacks. Here is a brief video demonstrating how albuterol inhalers are used. The canister should be shaken a couple times, and patients should sit upright and breathe out completely. Then they should breathe in slowly while depressing the canister, and continue breathing in for around 3 to 5 seconds, and hold their breath for about 10 seconds before exhaling. Albuterol can also be used to treat bronchitis and chronic obstructive pulmonary diseases, because in both of these conditions, the bronchioles are inflamed and more constricted than usual. In the past, albuterol has also been used to delay premature labor because it can help relax the uterine muscles. So nowadays, other drugs are normally used under these situations. Additionally, salbutamol has also been used for acute hyperkalemia because it helps lower potassium levels in the blood by increasing potassium uptake in cells. Albuterol use is not just limited to humans. It could be used in many animals, like the dog in this picture, as well as horses here.
Side effects of albuterol include uncontrollable shaking in any part of the body, muscle aches, rapid and irregular heartbeat, nervousness, throat and nasal irritations, nausea, and headache. The diameter of the trachea and bronchial tree up to the terminal bronchioles are controlled largely by airway smooth muscles. When the airway constricts in the event of an asthma attack, mechanisms must be put in place to relax the airway smooth muscles. Albuterol is capable of doing this by activating beta-2 adrenergic receptors. Beta-2 adrenergic receptors are G protein coupled receptors. Activation of these receptors leads to increased cellular concentration of CAMP, causing increased activity of protein kinase A, or PKA. Protein kinase A phosphorylates numerous targets that eventually lead to reduced intracellular calcium concentrations. As seen in this diagram to the right, calcium is necessary for contraction in smooth muscle cells, as its presence leads to the formation of calcium chromogen complex, which activates myosin light chain kinase, or MLCK. MLCK is responsible for increasing myosin ATPase activity, which contributes to muscle contraction. Therefore, the lack of calcium caused by activation of beta-2 adrenergic receptors mediates relaxation of smooth muscles, allowing the airways to increase in size. This reverses the effects of airway constriction.
There exist many synthetic pathways to produce salbutamol. One such pathway, which is relatively simple and cheap to make, is the following. It begins with Friedel-Crafts acylation of the starting material and installs a methyl keto group paired to the hydroxyl group. Substitution reaction protects the hydroxyl group with the benzyl group under weakly basic conditions. Next, the methyl keto group is brominated to allow for a nucleophilic attack by tert-butylamine. Then the adjacent carbonyl group is reduced to a hydroxyl group under strong basic conditions. And finally, the hydroxyl group is restored by treatment with plus D-benzoyl L-tartaric acid and simultaneously resolves for the R enantiomer. Some advantages to using this synthetic pathway are that it's cost-effective, it uses commercially available materials and reagents, it's short and efficient, produces 99.5% pure R-albuterol in 6 chemically straightforward and flexible steps, and it is clean. It can be produced with non-hazardous materials. One disadvantage of using this synthetic pathway is the low yield, with only the 30 to 40% of starting material being successfully transformed.
Albuterol is commonly used in sports, especially for athletes with asthma. At the 1972 Munich Olympics, it was banned because officials believed that it was a stimulant and could be easily misused by athletes. Later, inhaled salbutamol was allowed only if they had therapeutic use exemptions and could prove that they had asthma or medical needs for it. Doping in sports is monitored by an organization called the World Anti-Doping Agency, also known as WADA. In 2011, restrictions loosened slightly and allowed all athletes to take up to 16 milligrams of inhaled albuterol over the course of 24 hours. Doping with albuterol can be detected via plasma or urine test. An athlete is considered to be doping if more than 1,000 nanograms per milliliter is detected. Urine tests for albuterol needs to be conducted within 24 hours because it has a short elimination half-life.
That brings us to the end of our presentation on albuterol, and we hope all of you have an amazing day.